Rotchford here again on topics on opiate use disorders. Today's topic I think you'll enjoy. I know I'm going to enjoy talking about it. It's about playing basketball. Yeah, let's play ball. So, no, I'm not on the court. My patients are. I'm just a coach trying to help them play a better game. But I like the metaphor a lot regarding recovery and what it takes sometimes to get better. First of all, in basketball, it's not about just simply reading the rule book or watching it on television. It's in playing the game that one gets better. And hopefully with others who play as well as you and actually can challenge you and encourage you. There are no quick fixes. Yes, there are some things to be done on your own. That is, you can go out and practice your free throws or perhaps your dribbling. But to actually play the game well, you've got to do it. You've got to play it. Now, I can be the coach on the sidelines, giving some tips from time to time. Try this, try that, words of encouragement. But it takes time, progress, not perfection. All those little adages that we use in recovery, think about it like learning to play basketball. The part of the metaphor that I like as well as this whole sense of keeping at it is the importance of teamwork, the importance of the we. And on all good, effective teams, it is a we approach that needs to dominate in order for the team to prevail or to win the game or make the score, however you want to say it. Well, in recovery, that's true too. It's a we thing. And to emphasize the we thing is so very, very helpful. There's all other aspects of the metaphor that I like. We all know that there are times when it's easier than others to be performing well. And listen, if you don't have a pair of tennis shoes, it's pretty hard to play basketball well. Sometimes I, as a physician, I have to get patients tools, if you like, that will allow them to play the game well. That's an example of medication-assisted treatment. It's stabilizing them to allow them to go out on the court and play the game of recovery. There are other examples of that. If someone has a serious medical illness or a psychiatric disorder that's not being addressed, it's pretty hard to get out on the court and play ball. You got some basic things have to be covered. Maybe they need to have their glasses adjusted, right? Can't see the ball. You're going to have a hard time making a score or passing it to a teammate. So all those general health-related issues, as they apply to basketball, we got to make sure the players are healthy. In general, obviously apply to someone playing the game of recovery. We want their full health, their brains working as well as they can be. All that stuff. It just makes sense. And it helps also to have cheerleaders and supporters there rooting us on. Try not to distract us too much from what we're trying to do. That wouldn't be good. So, yeah, that comes up too. Sometimes supporters and people on the sidelines, in their desire to be of help and wanting to be helped, they can make matters worse, actually create distractions and problems for the players. Does that happen in recovery? Absolutely. If your family member doesn't understand the importance of sometimes staying on the sidelines and not feeling like they've got to get in the middle of the game, well, invite them to get to some Al-Anon meetings. Al-Anon's great for family members and actually people in recovery. So, if you haven't been to an Al-Anon meeting before and you have some recovery issues for you or a family member, check it out. See if it's of help. We can talk more about Al-Anon at another session. But for today, let's get out and play some ball. Have some fun.